The federal government have disclosed plans to have a minimum of functional primary health care facility in every ward in Nigeria to make accessibility, affordability and availability for their services closer to people. The Minister of Health, Asagi Ehanire, and Executive Director, PHCs, Faisal Shaibu, disclosed that the forthcoming PHC Summit is geared towards launching a historic program to transform the under-resourced, weak primary healthcare system in Nigeria. But Edis Uko completes the story.
Approximately 43% of Nigerians have access to quality primary healthcare services, with only about 4 doctors available per 10,000 people. In its efforts to improve primary healthcare services in the country, the Federal Ministry of Health, in collaboration with the National Primary Healthcare Development Agency, is set to hold a primary healthcare summit geared towards launching a program to transform the under-resourced, weak primary healthcare system in the country. Addressing newsmen on Tuesday in Abuja, the Minister of Health, Asagi Ehanire, disclosed the need to reform primary healthcare systems to have a minimum of 1 functional primary healthcare facility in every ward in Nigeria.
Now, Nigeria today is one of the countries with the worst indices for maternal mortality, under 5 mortality, TB, and so on. Where do you address all these problems? Where do all these problems occur? Largely at the grassroots level. Therefore, the idea of this summit is to ask ourselves, is our health system working well? Are we focusing where the investment should go? The idea is to have 1 functional primary health care center at every ward. That's where we are starting. And that is to establish the availability, to make sure that healthcare is available for the people where the problem is, and also within their reach.
Announcing the upcoming event, the Executive Director, PHCs, Faisal Shahib, said that the summit would help in achieving the Sustainable Development Goals in Nigeria.
But we are working together as NHIs and primary healthcare with the whole goal of achieving universal health coverage. And this is why this primary healthcare summit is important. It is a collaborative effort. It is a historic coalition between government, the private sector, development partners, and donors. President Muhammad Buhari actually launched the ambitious plan to revitalize 10,000 primary healthcare centers. And since then, over 6,000 primary healthcare centers have been renovated, but not revitalized. There's a difference, and we need to be clear about what the difference is. A lot of governments, a lot of National Assembly members have renovated primary healthcare centers. That is to say, they've improved on the infrastructure, and in some instances, they have constructed primary healthcare centers. But the most important aspect of the primary healthcare delivery is the human resources. This is why, for us, that is very, very key. We need to bring that to the front burner so that we can now truly transform primary healthcare delivery in Nigeria.
The summit is expected to create a platform for all intervention and involvement towards transforming the PHC system. Some development partners, donors, philanthropists also disclosed their involvement.
It is in culmination of this national insurance scheme on assumption of our leadership in 2019. We will be working closely with the National Primary Healthcare Development Agency under the auspices of the Ministry of Health to particularly work to ensure the implementation of the Basic Healthcare Provision Fund, which is an element of the National Health Act, as specially espoused in Section 11 of the National Health Act. As we are all aware, the Basic Healthcare Provision Fund represents a very good bridge between these very important agencies of the national system, the NPCDA, the NHIS, the NCDC, as well as the Federal Ministry of Health through the provision of the emergency medical healthcare services.
The summit, which is scheduled to take place on 24th and 25th March 2022 in Abuja, is expected to present ambitious and attainable plans that will lead to tangible and large-scale changes to Nigeria's primary health care system by the year 2030.